Okay, Abdullah. So if you tell me how will you take this scenario further? If this is your task, what are you going to do?
Should I just tell you or I practice with you?
You should, you tell me first of all.
First of all, I will introduce myself and ask from her daughter her her relation to the patient, and I will confirm the name and age of the patient, and then I'll ask her if what she knows about his father health and how he's been doing recently. And so after that, I would like to explore more about the father's health, like what if he has any previous medical condition and how is it managed. And then after that, I will tell her that as you know, your father is been suffering from stroke, and while he was in hospital, he had another stroke, and we did CT scan, and we have also done some other investigations. And I am really sorry that we don't have good news for you.
Okay,
So
giving the warning shot. Okay.
yeah. So after that, I would ask her if she wants me to carry on, or should I call anyone for her to
Hmm.
be with her at this moment. After that, I will disclose the results by saying that unfortunately we did CT scan, and we have found that there are big clots in both sides of his brain. And
There
then
is
I'll
there is a big clot which is expanded on both sides. Not two clots, it's one clot, but
yeah,
it is going on both sides of the brain.
okay. And after that, I will give pause and to see how she is responding.
Hmm.
So then then I'll tell her that we have given the multidisciplinary team has had meeting on your father's case, and we have decided that we cannot perform surgery because because of the that massive clot
Hmm.
uh, affecting his both sides of brain. And but we will we we are already giving him IV fluids and some painkillers so that he can be comfortable with whatever condition he has. And we have decided we cannot do operation on him because all the doctors in the team have think that the surgery is not in the benefit of the patient, and it will only cause more problems to the patient. And I will again give pause and ask if he is understanding what I am saying. And
Okay.
then
So in simple words, your protocol, you will follow the spikes protocol. Okay. And setting up again the conversation, then perception, then invitation from the patient's relative, then knowledge, then empathy, sympathy, summary, strategy, all those things. Okay.
yeah,
uh, Setup is quiet room, go to the quiet room, no bleep, no phone, mobile phone switched off, no distractions, no noisy area. Get someone with you, introduce yourself, check the identity of the relative, check their relation, then confirm their perception, what their understanding is, and also find out what they know about the patient's current situation, current condition, and then take it from there. Okay. Then explain what you want to discuss today. After you have received the information about the perception, then mention that I want to talk to you about your dad's condition. At the moment, he is not well. Okay, and give a pause. Wait for them to invite you. Okay, doctor, tell me what you want to say, and then you move further and give them the bad news in one single sentence and give a pause again. Then give the further information in small pieces. All the knowledge should be delivered with the breaks so that they can absorb whatever you have told. Do not simply continue. It should be a kind of conversation, and you do not take the charge, and make sure that the relative remains with a good understanding, and continue sympathy, empathy. If the patient's relative starts crying, do not continue talking. Give a pause, offer them tissue. If you feel that they are distressed, offer them water, and offer them sympathy. Acknowledge that I know it can be very difficult. I can understand there is a lot to take. It is not easy when you see, when you imagine, when you think of your beloved one lying in this situation, in this condition. It is very hard. And I just want to reassure that we are with him and we are with you in this difficult time. So, sympathy, empathy with the very good, polite words. Okay.
Okay.
Uh, then continue about further planning, and you can mention about doing not doing the CPR. Mention that we at the moment we are just giving him time to see which direction he goes to. There is a possibility that he can improve, but uh, in the presence of a large clot in the brain, and with such a deterioration, the chances of improvement are very thin. And we feel that he is likely to deteriorate. However, at the moment, we are giving him some time, and we are just observing. We are keeping him comfortable, giving painkillers and IV fluids. If he improves, we will rediscuss the case with the neurosurgeons and with anyone else, whoever can be helpful for your patient. However, in case if he deteriorates, if his heart stops beating, or if he stops breathing, we will not jump on his chest, because this will add more misery and torture to your patient. We do not want that to happen. If he goes, we will let him go. Okay, if he goes, we will let him go. At the moment, we are giving him time. We are still observing. We have started the IV fluids and we have started painkillers, and we will see how he does in next few hours. It is very difficult for me to tell you for certain how long we will continue observing. Uh, it will be a short period of time, a few hours to a day. Okay, if he does not show any signs of improvement, then we may get more clear answer which direction he is going to. But if he starts improving, then we can always revisit our decision, and we can go back to the neurosurgeons and tell that the patient has improved. Do you still want him not to be operated, or you think that now your decision has changed? This is not the final decision. However, because at the moment we are in a limbo, we are in a situation where we do not have any clear answer. We are still observing. We have started IV fluids. We are keeping him comfortable from the pain point of view. And if he improves, then we will revisit. If his heart stops beating or if he stops breathing, we will not jump on his chest. Does it make sense? And
And
again, the same thing. If you have any more question, feel free to ask. Anytime you can contact our ward nurses and you can ask them to arrange another meeting. I'm very happy to come back to you with answers. I'm very happy to offer you more support if you need. and we can be available anytime. So if I'm not available, my colleague will be happy to come and talk to you. So I will make sure that I document all those conversation, and we keep our team in the loop of the conversation, and we also keep you updated.
At the end, should we tell them that what we can do for your father is that we will be uh, giving him nutrition through IV line or NG tube or whatever.
Uh,
And
at the moment, I think we should stay focused. This is a very extensive topic. Okay,
okay,
end of life care, DNA CPR, palliation, this and that. These are all very extensive topic. The main thing in this is that they want you to discuss about not resuscitation. Okay, if the patient
okay,
deteriorates, then do not resuscitate the patient. And you can mention about the MDT, that multidisciplinary team that includes the neurosurgeons and the physicians and the ITU team and the neurologists. They all have discussion, and they know in detail about your dad's condition, and they all have come with the conclusion that he is not so well to tolerate any treatment, or to show very good functional outcomes. So if uh, they want to operate, or if they want to offer any treatment, that is likely to be uh, fruitless, and that may actually increase the misery by extending his life, and he may die with more complications like chest infection and the bed sores, infection of the wounds, and stuff like that. Okay. Uh, so we need to then, at the end, we need to summarize everything, and offer them further help for the meeting. If they have any question, they can always come back to you. Is that clear? Okay. Always follow the spikes protocol for breaking any bad news.